Hi everyone, welcome to the Jobskin webinar series on the custom compression for genital oedema. My name is Adam Ho. I'm the Managing Director of Jobskin Australia and New Zealand. With us today is Rosemary Kendall, our presenter, the clinical representative based in WA. Joining us soon will also be Veronica Eichmann, our clinical representative in New Zealand. With that, I will kick off and hand it over to Rosemary.
Thanks everyone for joining us for this next webinar in the series that we've been running over the last few months. Hope this is useful to you in your clinical practice, and we're tackling one of those topics that probably comes up less often rather than more. And I don't know about you, but for me as a lymphedema therapist, I always feel very grateful when we look at these topics, the topic of genital edema, because it's complex and tricky. So this afternoon, what we're going to do is we're going to just kind of a bit of a review, really, of some of the challenges that are involved, and then an overview of why you choose ready to wear versus custom made. And then, obviously we need to consider the different needs of men and women, girls and boys with genital edema. Then we're going to look at what the custom garment options are for genital edema that Jobskin offers. We're going to look at how to measure, and we've got some measuring videos that if you haven't looked before, I'd really encourage you to go on to www.jobskin.com, because we have got a series of videos that walk you through how to measure all kinds of garments. And if this is something that you're building confidence in, they're brief videos, they're sort of succinct and to the point. But if you have got a patient coming in that you need to measure and you feel like you just need to just kind of make sure you're on top of exactly what you need to do, if you've got a couple of minutes, you can just do a quick check through by watching those videos. So it's a very helpful way to learn, and particularly useful for people who are in regional or rural areas, and certainly at the moment for those of us who are in lockdown and therefore less able to access physical supports and resources. Then I've listed case studies on the contents, but actually what we're going to be doing is just looking at some case scenarios and look at how the garment was prescribed. And this is really because we're trying to protect patient confidentiality. And when we're looking at genital edema, images can be very exposing, and we really don't want them out in the public domain. So just to ensure that they're not mishandled in any way. And then we'll just finish just with a very, very brief overview of prescribing and ordering for garments. So just a couple of things I want to say straight up. They're just because it's almost like, it's not quite that it's the elephant in the room, but I think sometimes people get a little bit confused as to, well, why is something not graduated compression? But I understood that the law of Laplace is always used for compression. So this is kind of like the compression theory 101. I'm sure everyone here on the call understands the necessity and the importance of graduated compression. Simply put, we want to encourage fluid flow from distal to proximal. Now, this applies to limbs, but it doesn't apply to the torso. So when you are considering garments, you don't need to be looking for graduated compression, because it's just not a thing. It doesn't apply to the torso. And similarly, the law of Laplace doesn't apply to torsos. It does actually in terms of the design principles, but in terms of practical working or fundamental understanding, you don't need to give consideration to this. Brief overview, essentially the law of Laplace is used as a basis for graduated compression, because we know that if we apply the same level of compression over larger circumferences rather than smaller, the compression is reduced. So obviously compression over torsos and genitals is going to be reduced in relative to limbs. But the other thing I would add to this, and if you were at the ALA conference, or in fact, if you weren't at the ALA conference, there is a lit review that you can access on our website, which looks at what happens with compression over larger circumferences, so particularly in larger people. And you can also use the same principle in relation to the torso, the torso in relation to limbs, because circumferences are larger and there's often a higher percentage of fatty tissue around torsos, and different tissues respond differently to compression. So for the geek in you, if you want to know a bit more, you can look up that lit review that's under the support and training tab. But anyway, we'll set that aside. Other than to say also, assigned compressions are unreliable for torsos and genitals. Now, I don't mean, if you request for something at 30 millimeters of mercury, you're likely to get 50. Not that, because the manufacturing principles are the same, but the accuracy of the compression is unreliable because torsos behave differently. And so if you were to order a garment that you're looking at, say, like a bike short design for torsos, and, it's obviously going to be on the torso, but it's for genital oedema, I can't honestly say to you, if you request 30 millimeters of mercury, you're going to get 30 millimeters of mercury, because there are too many variables. And this is the same for every single manufacturer. No one can really tell you that that's what it's going to be. However, it is a benchmark level. And so you have the assurance that it is a benchmark level, but there's variation within that frame. Now, the challenges that we specifically face with genital oedema, and I know I'm not telling you anything you don't know, is that it's sensitive, it's exposing, it's intimate, and not every patient is willing to perhaps disclose that they have genital oedema, or to disclose the significance of the edema or the variability of the edema. And that's one of the clinical challenges that we face. And genital oedema is very variable in presentation. And then, of course, we've got the added complexity of, because it's the genitals, of how it impacts personal hygiene and toileting. So they're kind of things that we keep in the back of our mind when we go into this kind of topic this afternoon. And the next thing that we need to consider is, like all compression garments, ready to wear. When do you choose ready to wear? When do you choose custom made? Now, in theory, and this applies for whether you're considering a sock or an arm sleeve or a whatever it is, custom made becomes a preferred option when a patient doesn't fit a ready to wear garment. Now, we know this for, let's just say, basic garment is an arm sleeve. If the circumferences exceed the ranges, or if the patient's shape and proportion is not sort of normal, for want of a better term, then all of a sudden there are no ready-to-wear options. When a suitable style is not available for whatever reason, it might for the clinical needs, obviously, but that there's multiple reasons why that might be the case. When a patient is an odd shape, and that really comes down to shape and proportion, and also when there's design options and modifications are required, and particularly this might be the impact of donning and doffing. But in reality, when we're looking at genital oedema, custom-made options or custom-made garments often become the preferred option because ready-to-wear options are limited. It's actually quite tricky to get what we need to fit what we need. So why would you consider Jobskin for genital oedema? Few reasons, and a lot of these apply to many different garments that you might consider Jobskin. One is that's the obvious we've just been talking about, when a ready-to-wear garment's either not available, not appropriate, not suitable for the clinical presentation. Where you need something that's fully customizable for complex needs, where there's considerable demands that are being made from the one garment. Another reason you consider Jobskin is that really any size can be accommodated. Our design team and our manufacturing staff, they make garments from, like little gloves for tiny babies through to enormous belly bands for super morbidly obese people. So Jobskin truly can accommodate any size, and the same is true for genital edema too, because we can have some extremely complex presentations. You might also want to consider Jobskin because some of the customization options, like specifically accommodating altered skin integrity or specific a design in order to improve comfort. And I would also add into that, when we're doing garments for lymphedema or edema of any kind, the fact that we can move seams around to ensure as little disruption to lymphatic pathways as possible. Now, Jobskin garments are eminently modifiable, and as I mentioned earlier, oftentimes this is to assist with donning and doffing, and sometimes actually it's not just about how the garment functions, but how the garment appears that may also assist. All right. Now let's look at some of the other considerations for genital edema. I did mention the drainage of the lymphatic pathways. So if garments can be modified or altered to protect intact lymphatic pathways, well, that is the ideal, obviously. We need to consider the functional impact of genital edema. So certainly comfort is one, but particularly personal hygiene and the ease of toileting. People obviously need to be able to get garments on and off, or at least be able to toilet with ease, as I've said there. One of the other things that is a little bit tricky with genital edema is good anchorage, because obviously the genitals sit at the bottom of the torso. So we need to ensure that the garment is stable in order for it to be effective. And then there are obviously differing clinical needs for male and female edema. Generally, female genital edema benefits predominantly from, an upward pull, so there is compression up against the labia and around the vulval area. Sometimes it needs anterior compression over the lower abdomen and the pubic mound. For men, predominantly the edema is in the scrotum and plus or minus the penis, and which is sitting essentially outside the torso, but there may also be then lower abdominal edema that it is also a factor that might need to be taken into account. So that can be plus or minus. Now, also, what are the garments that are available? And actually, it's quite a simple selection, but it really comes down to how you prescribe the garment to make sure that it's workable for your patient. For women, either a bike short or a knickers design of garment is appropriate. And we will, when we look at the prescription guidelines, they're not really case studies, they're case scenarios. We will look at one of each of those. And then for men and also for boys, one of our case studies is a pediatric case study. Then there's a scrotal support plus or minus the kind of the bike short component or an abdominal component. So we're going to look at those. But that's basically the range of garments. But like all Jobskin garments, different features can be built into whatever garment. For example, the garment that you can see on the left of your screen, the female bike short garments there, that could be part of a bodysuit or it could be part of full length tights. The scrotal support that you can see on the right can be part of a bigger garment, or it can be just in isolation as it is. And actually, can I just note, because in the previous webinar I tried to refer back to this on a previous slide, but I've actually got the little webinar window sort of showing in the bottom right of my screen. But on the right, the red scrotal support there, that's a good view of how routinely the scrotal support will sit at the back. So so in fact, you don't have anything circumferential in a standard scrotal support around the hips and the bottom there, but it can be built into a bike short if you need that kind of compression. So we're going to look at how you measure the torso and how you measure specifically for these garments. They're relatively simple garments to measure, surprisingly. They are intimidating oftentimes. I think people find it far more intimidating to measure a torso or to measure genitals than they do to measure limbs, but in fact it is really quite straightforward. What you primarily need is a retractable tape measure, and then most of you will be familiar with the suite of paper tapes that Jobskin uses to get very comprehensive measurements. You would only ever need, if you're including the bike short component, the full leg tape, which previously was teal, and you'll notice in changeover, you've probably got teal tapes in your clinic, but it's changing over to sort of more like a nautical blue colour. Same tape, just different colour suite. And then you would need one or both of two forms, the waist high, thigh high form and the scrotal support form. So this is the scrotal support form here, and it is a surprisingly simple garment to measure because in fact you only need 6 measurements, which we'll have a look at shortly in the measuring video, and these measurements are recorded here, and then it's just a matter of if you need any slight modifications, like you want the scrotal area lined, or maybe you need suspenders to assist, particularly when you've got a bloke with a big belly, or whether you want silicone backed elastic for anchorage, and then obviously colour choice. The thigh high form, if you haven't seen one of these before, it feels slightly more intimidating, but let me break this down for you. The garment styles, essentially, if you are choosing a garment for genital edema, you would either be choosing the panty girdle with a closed pubis. Here, this is style number 119, which is this one here. Or you may actually be, for a woman, you might be opting for a panty brief, which is somewhere down, oh, it's somewhere on the list. I can't see it straight. There we go. 1120 there. And then these are options and modifications that relate to all lower limb garments, but hopefully by the end of this webinar, I will have distilled a significant number of those for you, but the most commonly used one is the double abdominal panel, and you can request in the comments section a particularly reinforcement over the crotch and pubic area. For pubis styles, for women, we do have a range of options, but can I just say, if you're choosing it for genital edema, you would be choosing the power net and the lining, because the satin, the mesh, and obviously an open crotch would be addressing everywhere except the area that you need the compression. So you would just automatically be choosing power net and lining. Here, this is where we put the torso measures. They're simple measures, as you'll see in the video. And here, if you are including the bike short, component like thighs in the garment, then those measurements would be recorded here. Now we're going to look at 2 videos. The first one is how to measure for a scrotal support, and then I'll go straight on to playing the second one, which is measuring the torso. It starts with the patient in long leg sitting with a full leg tape along the length of the leg, obviously. But can I just say, if you are only measuring for bike shorts, my tip would be you do the anchor tape around the heel so that we are then able to assess the length of the leg, we, the design team. And then you only need to start wrapping the circumferential tapes from above the knee, wherever it is that you want the distal end of the garment to start. Hopefully that will make sense when you see the video. All right, let's play.
Only 6 measurements are required for the scrotal support and are taken using a Jobskin retractable tape measure. The patient should wear underwear or an interim support at the time of measuring. If this is not possible, the penis and scrotum can be lightly bandaged or cling wrapped to simulate the position they would sit in the support. The first measurement is a circumference where the top of the support will sit. This is a position of comfort for the patient and is often where he likes his pants or jeans to sit. This point should be marked with the Jobskin body marker highlighter. A linear measurement is then taken from this point to the base, which is the top of the penis. A contour measurement is required around the scrotum from a point approximating the inguinal ligament on one side to the same on the other. A further contour measurement is then taken from the anterior of the base of the penis, over the scrotum and under to the perineum. The next measurement is a diagonal one taken from the anus across one buttock cheek to the iliac crest, and the final measurement is a linear measurement from the gluteal fold to the top of the support as marked for the initial measurement. All these measurements should be entered onto the measuring form at the time that they are taken, then the form completed as explained in the introductory video. Regardless of the leg length of the waist-high garment, the circumferences of the lower limbs should be measured with the teal measuring tape. Ideally, an anchor tape should be secured at the ankle and then tape secured from the point on the leg which matches the distal end of the desired garment. Refer to the Measuring Full-Length Lower Limbs video. Additional measurements are required for a waist-high garment, and these measurements should be taken with the Jobskin retractable tape measure with the patient in standing. Using the Jobskin body marker highlighter, mark the point on the body that circumferential measurements are taken so that height measurements can then later be taken. The required circumferential measurements are the waist, the desired top of support if that's different from the waist, the largest point of the buttocks, the midpoint between the waist and the largest point of the buttocks, and the left and right gluteal folds. With the patient standing straight and upright, the required length measurements are taken from the floor to the gluteal fold, that is the fold of the buttocks, to the waist and to the desired top of garment. In addition, length measurements are taken from the gluteal fold to the top of the garment. Note that all length measures are linear measures, not contour measures. All these measurements should be entered onto the measuring form at the time that they are taken, then the form completed as explained in the introductory video.
Just for your information, the introductory video that those two videos refer to is on the website, and it's basically an explanation of the Jobskin measuring system. So now let's sorry, I've just had a distraction. Somebody was just interrupt me. I apologize about that. But look, one thing I would say is that in those two videos, obviously the subject in the videos is normal proportion and straightforward to measure. And you and I both know that some of the people that we need to put into compression are not quite so straightforward to measure, because their proportion is a little bit different. If they're very large, it's more challenging to measure. So I know the design team will love me forever if I highlight right now that if you can send photos, that helps considerably, well, with complex shapes. On the website, we do have a secure portal that you can upload the photos through, so you're not having to email photos. So that's worth considering. And when you're taking those photos, if you can take them with a tape measure in place, that makes those photos even more useful. A couple of additional measurements that would be that are helpful is from the waist at the front through the crotch, so passing it underneath the pubic area and up to the waist at the back. In one of our sort of prescription case scenarios, you will see how that's particularly significant. Also coupled with a linear measure down the front from the waist at the front down to the pubis and from the waist at the back to the gluteal fold. Again, this will become clearer when we look at that scenario, because you can see how the fit of a garment can just be completely out if the proportion of a patient's shape is not clear enough to the design team. So we're going to look at those sort of, we're going to look at 4 scenarios, and this is a patient photo, obviously de-identified, but this woman had something that was not hugely untoward, I suppose you could say. She had persistent swelling in the labia following some cancer surgery, and had been unable to find an adequate and comfortable compression garment. So when we looked at what the need was for her, she needed, which is something fairly typical really, that needed that upward compression against the labia, but then she also needed some anterior compression for edema over the pubic mount. And you can actually see in the image how there's still, when this was taken the first time she was fitted with the garment, you can see that there is some swelling through that area there. So we, in choosing a garment between the two of us, you know, the patient and therapist, we opted for bike shorts. And a couple of things I wanted to highlight. It's got this, you can see the seaming through there, that there is this, it's like a upward sling that extends. If I just flick back one page, you can see the shape of that here. So there is this fabric that's been stitched in a change of bias alignment so that the pull is very much up through the pubic area and anchored. It's basically the pull goes all the way up to the waistline. But in addition, she had a abdominal support panel here to give her additional compression back against the pubic area. We opted to have 5 centimetre elastic here for anchorage, stability, and for comfort, and 2.5 centimetre elastic. You don't have to have elastic at the bottom of bike shorts, but we opted to do this so that there wasn't any kind of riding up into this, into the basically the inguinal line, because that's obviously going to compromise lymphatic flow. So we wanted to make sure that was really a very stable garment. This didn't have, this wasn't silicone backed elastic, it was just standard elastic at the bottom. And just a couple of sort of handy hints, I suppose you could say, about 5 centimetre wide elastic. If you have somebody who's very curvy, so like bigger hips, smaller waist, and if they're carrying additional weight where they tend to be a little bit roly-poly, then a 5 centimetre elastic band is not a good idea, because that's just going to fold or roll and then it starts cutting in. So you're better off to have just a 2.5 centimetre elastic, or potentially actually no elastic at all, but it's just built into, I'll show you in one of the scrotal supports a little bit later. But if someone is fairly slim, or if you are having the so-called waist actually below the waist, sort of on the, particularly younger women like to wear their, what they consider waist high is actually below their waist. When you have 5 centimetre elastic, it sits nicely and it avoids a bit of a muffin top. Same thing for men, if they're wearing lower sort of garments on their hips, 5 centimetre elastic provides good anchorage and good stability. And it's the muffin top. Now, this is the case study here that the prescription scenario that I think is particularly helpful for understanding how additional measures can be supportive. This particular lady had female genital edema, plus she had some lower abdominal edema from multiple pelvic procedures. So it was a situation that had developed over time. She also was carrying additional fluid in her lower limbs, but she was not keen to deal with that at this point in time. And she was short in stature, but quite round in her build. So when you look at her shape here, trying to get adequate compression in here and accommodate her thighs. I have trimmed the photos just for privacy and confidentiality, but she was also quite a challenging shape in her lower limbs. And she lived alone. There's no way that she could get a flat neck garment up. She had multiple comorbidities, so we really needed something that was manageable for her to don and doff. Now, you can't see it quite so clearly here, and this was a slightly earlier form of the garment because we then did revise the knickers line, but she's got quite a wide abdominal support panel, plus she had the uplift panel going through the pubic area. So, but I want particularly to highlight a couple of things. One is you can see, like on a normally proportioned person, like the subject in the video, when you put a tape measure around, the height at the back and the height at the front in terms of from the floor is pretty level. But you can see here the front of the waist, it really needs to sit up over this lady's belly, whereas at the back it sits in what we often refer to as a small of your back, and that's quite a bit lower. And so a straight, if we just provided a height measurement on the side, which is where we would commonly measure, it's going to sit too low at the front and too high at the back. So it's just going to fold over or roll down at the back. So we really need a way to indicate to the designers how this lady's proportion, it varies a little bit from what you could call the norm. So we need this measurement that goes through here. But even so, that doesn't tell the design team how, how to alter the front and the back height. What we then need to do is say of that measure that's taken through there. Oops, sorry, I bumped the mouse pad. We need to actually indicate the proportion front here and proportion back here. And in fact, for this particular lady, I also marked on the side where the back of the waist would sit and where the front of the waist would. So I took measurements down the side from the true waist, like the side waist, to the floor, front waist to the floor, back waist to the floor, but all those measurements were taken down the side so that I didn't have tissue interfering with the measurement. I hope that makes sense. And the other thing I just wanted to highlight here is that we routinely take a waist measurement, a largest point of hips measurement, and a midpoint. And normally the midpoint measurement would be partway between the waist and the largest point of hips, but you can see that that would clearly not be the point, not be the case here. So we still take a largest point of the hips at where you would consider that would normally sit, then take the waist, and then take the midpoint measurement, so that you can see how the design team are gradually getting a much more accurate picture of how this lady sits. And in fact, for this particular woman, I provided two waist measurements. One is the circumference around where the back of her waist was, like a straight measurement across, but then also an angled measurement as to where the waistband would actually sit. So all of those actually very straightforward, but additional measures help get a good fitting garment. All right, now this one is not so much a case scenario, but it's more just considering some of the options that are available, because in its sort of simplest form, this is what a scrotal support looks like, the red one here, where, oh, whoops, sorry, I bumped it again. Essentially, it's a wide 5 centimetre band that goes around the lower hips, where the substance of the garment is around and underneath the scrotum. And remember, I referred you to one of the images earlier. It's just got these diagonal bands that go up, sort of tuck under the gluteal fold and then across the bottom to anchor back up here on the sides. And you can request, if this is yours and the patient's preference, for a hole to be there for the penis to sit outside the scrotal support if that's appropriate and desirable. But where there is lower abdominal edema also present, you may want to consider a couple of options. One is you can add in the torso component of the scrotal support, or you might also consider going into bike shorts. And like all other Jobskin garments, sometimes people, particularly patients who've been palliated, they might need to have IDCs that need to be accommodated, or perhaps stoma bags, and all of these can be accommodated in the garment. Do you remember I earlier said something about 2.5 centimetre elastic versus 5 centimetre, and I said there's one on a male garment here? There is actually elastic still here, but it's internal, it's not above, and it's sort of more a discrete part of the whole garment. So they are the options that are available to you. And then the last prescription scenario we're going to look at is actually a, this is based on, like the 2 female ones, based on a clinical presentation. And this was for a boy, I can't recall, but his age was somewhere between about 8 and 10, and he had a very marked vascular malformation, which meant that he had an almost coiled sort of penis, enlarged, very, particularly for a small child, it was very, very large, and he had very, very swollen scrotum. So he was attempting to go to manage at school and needing to go to the toilet at school, and he was not coping at all. He had been provided with a sling, and it wasn't aesthetically, it wasn't great if he went into the toilet and anybody saw him, but also it was not easy for him to manage. So the treating therapist approached Jobskin, and this is the garment that was designed for him. Although this particular garment, this is one that was made specifically for the mannequin based on his case presentation, but he did have an opening for the penis so that he could take himself off to the toilets at school, and he could toilet easily without having to remove his garment. But he had the abdominal compression, which was required. He had the support for the scrotum, which was clearly required, but his penis was outside of the garment, and then he just wore his jocks over the top, for dignity, and it provided some degree of support for the penis without, the impact of a compression garment over the penis, much as clinically it might have been helpful for him toileting independently at primary school. It was really not an option. Okay, so we're just going to finish up. We've got a little bit of time for questioning, but what you need to be aware of if you've never ordered a Jobskin before is that in addition to the measuring forms, you need to complete just a standard order form, which has got delivery details, and then that form can be emailed to customer.service@jobskin.com along with the relevant measuring form. And any queries, you can contact the customer service division on the number that you'll find on the website. I do just want to highlight, as always, that we really do endeavour to provide you with a significant amount of clinical support, and that comes in a few different forms. If you go onto the website, jobskin.com, you will find a large range of resources under the support and training tab. We are doing a little bit of tweaking on the website at the moment, so we might move some of those around to make them easier to find. But there's articles, there's lit reviews, there's all the measuring videos, there's measuring forms, there's brochures, an extensive amount of information. But in addition to that, from a personnel point of view, Veronica and I are always available to answer clinical questions or to provide you with support. We can do Zoom meetings so that we share your clinical consults if that's the support that you require, particularly during lockdown, or emailing us, and booking phone calls is another very good option. And I always say on these webinars, I cannot underestimate the value of our design team. They are completely awesome with coming up with extraordinary solutions. So if it's a construction or design scenario that you're really trying to troubleshoot, then please don't hesitate to give them a call on that customer service number and you'll be put through to one of the design team. So as I say, we've got a couple of minutes that we can answer any questions if anyone has got any. We've got webinars coming up, multi-trauma and recon, which should be a nice lateral thinking one in September. We're hoping that the Burns Conference speaker that Jobskin is sponsoring will be our guest presenter for our October webinar, which will be about compression for all sorts of clinical indications. So I think that will be awesome. And then we're going to finish off the year with a Ask Me Anything scenario for our design team. So jot those in your diary. But for now, if you have any questions you're welcome to speak up, but if you'd prefer to type them in the chat, then Veronica will just share those questions with the group.
And just while everyone's collecting their thoughts, Jane and Julia, thank you for joining us today. If you could just flick me an email, I've popped my email address in the chat, just to make sure that I've got your email details to be able to send you out a certificate.
If we don't have any questions that you're happy to share, you may still have some questions that you would like to raise, but you're certainly welcome to send Veronica and I, or the design team for that matter, an email if there's something we can help you with. But if we don't have any questions, thank you very much for joining us. We appreciate your time. We hope this has been helpful to you. Over to you, Adam.
Adam, you're just on mute.
I just wanted to say, I wanted to mirror Rosemary's sentiments. Thank you all for joining us. We hope to see you in our future webinars. And until then, take care, stay safe. Bye-bye.
Bye-bye then.
Thanks, Liz. Thanks, Dion.